Hello, and welcome to another session of Voices in Healthcare Cloud. We are so excited today to share with you Dr. Patrick McGill from our Community Health Networks and Ellary Rose, a healthcare subject matter expert from Microsoft. Today, we're going to hear about these two who have great experience in patient engagement, patient experience, and how to bring an unknown customer to becoming a customer. And it's really all around this framework of creating digital consumer experience that just make navigating healthcare super simple. We talk about many different things. Got to hear a little bit about Dr. McGill's background, how he got to where he is. They translate healthcare experience to retail experience and how healthcare really needs to step it up. I think this conversation is really going to open your minds and challenge you to think about digital consumer experience in healthcare in a different way. Excited for you to hear from these two great experts on the topic. Hey, everybody. Thank you so much for joining us today. We're so excited to have Dr. Patrick McGill from Community Health Networks and our resident subject matter expert, Ellary Rose from Microsoft. So I'm glad to have you guys today.
Thank you. Thanks for having us.
Glad to be here.
Yeah, so Patrick, would love for you to tell our audience a little bit about yourself, kind of what your current role is and how you got started at Community.
Yeah, happy to. So like you said, I've served as the Chief Transformation Officer at Community. I've been at Community Health Network for about 13 years. For those of you who don't know, Community Health Network is based in Indianapolis, Indiana. We're a multidisciplinary system, across central Indiana, 5 hospitals, 4 other small specialty hospitals, about 1,300 providers. So pretty mid-sized health system. In my role as the Chief Transformation Officer, I have a broad range of responsibilities. So I oversee all of IT and analytics, all the way to population health, social determinants, value-based care, some executive responsibilities, and then things in the middle like cybersecurity and business continuity. So I have a history that started in informatics, kind of worked my way up through informatics, and then moved into looking at clinical variation and strategies for growth. That's where I got into value-based care and some pop health. And then for the last year, have served as the Chief Transformation Officer. So really oversee pretty much everything digital, a lot of patient experience analytics, especially as we're creating that patient experience, which I know we'll talk a little bit about later, kind of rolls up into transformation. So it's a unique role at Community, but it's exciting because we get to do a lot of different things and have a great team around me that helps enable that broad range of responsibilities that I have.
Awesome. And what would you say is your favorite thing about your current role?
I think the favorite thing is every day is a little bit different. That sounds corny and kind of cliche, but it's true. I see patients on Mondays, and so I get to still experience the clinical side of delivering care and kind of live in that world. It's interesting when I'm seeing patients, people don't really know what my administrative role is, and even the people that are in clinic. So I get to be a doctor for a day, and that's always exciting. But the rest of the time, I have executive responsibilities in the organization, so get to really work on strategy. But I think the thing that's the most exciting, or the favorite thing I do is every day is different in terms of, like today, I had multiple conversations on value-based care contracting, had other conversations with tech startups and technology startup companies and how we can grow our footprint. I have other I own the relationship that we have with Walgreens. And so there's a strategic partnership piece of it. So literally every day is different. It's kind of what attracted me to family medicine, is that you never know what walks in the door. Could be a child, could be an elderly person, could be diabetes, it could be back pain. And that's kind of how my job is now. It could be something related to technology, it could be related to population health or social determinants, health inequities. My every day is a little bit different, and every day throughout the day is a little bit different.
At least you don't get bored.
No, it's never boring. I will say it's never boring.
Yeah. So on the flip side, what's the most challenging thing about your current role?
I'll give you two parts to that answer. The first part is we're experiencing many of the same challenges that the other health systems are experiencing. Labor shortages. How do you do more with less? Certainly the cost pressures that we're all experiencing. So that, how do you function in a healthcare system that has, shown to be very critical during the pandemic, was the center of the pandemic, obviously, and now coming out of the pandemic. So that's one challenge of just what does the new normal look like? I think we're all getting used to that. As you can probably tell, I'm somebody who I like to go fast. I like to really do innovative things and think differently. And we have a lot of legacy thinking just in healthcare, not necessarily with
Mm-hmm.
Community Health Network, but it's that constant challenge of what is too much? What are you trying to change too quickly to not create change fatigue, especially as we're dealing with burnout in healthcare? So it's how do you strike that even balance of changing and transforming like we all need to, we know we need to, but not doing too much to create more problems or more challenges. So that's the constant struggle that we always have with any kind of transformation, is what's too much and what's too little.
Yeah. Yeah, really great points. So Ellary, would love for you, I know you've been on before with us, but love for you to do a little bit of intro. And then I'm curious as to how Dr. McGill was just talking about, it's not just community with these challenges, as you support a lot of our healthcare customers. Are you seeing that across our other providers as well?
Yeah, absolutely. Well, as Shelley, as you mentioned, I'm one of our healthcare subject matter experts. I actually get to work with our most strategic clients in the United States, Canada, and Latin America on their consumer relationship and experience management strategies. So, the world that I live in is really focused on consumerism and how that's increasing and how it has increased, and the expectations for consumers and other industries are really impacting the type of experience that they want in healthcare. So, in addition to all of the things that Dr. McGill spoke to, I would say we weren't built from the ground up around the concept of the consumer and really kind of that
Mm-hmm.
Disney experience, the Disney effect, what retail has built. Everything in other industries feels very centered around the consumer, understanding what they might want, how they might want it, and really catering to them. It feels like we're now at a point where everybody is taking experience very seriously, but we're almost having to go back and retrofit some things
Mm-hmm.
in order to enhance the experience, and that can be really challenging when an infrastructure doesn't support it. I think a lot of our clients have been doing best of breed over the years, so they have a lot of point solutions, sometimes thousands of applications, tons of disparate data. So it's hard to deliver on a great experience when all of the information that you have about your consumers is living in other places. So, really, again, financial pressures. Our clients are reporting the worst losses in,
Mm-hmm.
certainly, I've been in healthcare for 14 years, but throughout my career, it's been the harshest that I've seen. Dr. McGill, I don't know if you agree. You've been doing this for a lot longer, but that, and then the workforce
Well, not a
crisis and
lot longer,
burnout.
Ellery. Come on, don't
Well,
sell me
I
short. Come on.
mean, uh, you're just more experienced in every
That's right.
way. That's all.
Right.
But it's very clear that we're in a very challenging time, and I don't want to be all doomsday, but it doesn't really seem like there's a ton of light at the end of that tunnel. And so I think we're all focused on, of course, how technology can help to automate some of the manual processes and help to digitize the experience to
Mm-hmm.
help get healthcare set up with an infrastructure that allows them to innovate and run fast. Dr.
Right.
McGill, while I just mentioned innovation, curious to know what keeps you from being able to innovate? What keeps Community Health Network from being able to truly innovate? Or do you feel like you're at a place where you are able to be innovative?
Yeah, I think there's a couple ways to look at that. One is how would you define innovation, right? Are we
Yeah.
developing new solutions that are novel, that haven't been seen? That's not who we are. We're a community-based health system. We don't have 100 developers that are going to be developing. So we really look strongly to that build by partner, and how do we learn from others and kind of stand on the shoulders of others, and I think that's how we're innovating is to be more at the leading edge versus the laggard, of after things that have been. So that's how I would define innovation for us and how it fits into our strategy. But I think what's holding us back is probably many of the challenges that we just talked about: labor, cost. I think the other thing that sometimes goes unnoticed or we don't talk as much about is when's the right time to pull the trigger, right? I mean, in healthcare, we don't necessarily like to fail fast. That's just not who we are from a clinical delivery. And so that's much different than technology companies or Silicon Valley or others where they're born on failing fast. And so how do you know when's the right time to pull the trigger? How do you know what's the right trigger to pull? I think those are some of the conversations that really hold us back, and we just get kind of this analysis paralysis when it comes to trying to do new things.
Yeah, spoken like you've done it before, for sure.
Well, I am
Shelley,
very experienced.
Yeah, we've already
so.
established he's
Yes.
very experienced.
Yes, very
Yeah.
experienced. Well, you both kind of talked about patient experience, and Ellary, you even referenced the Disney experience. And so, when we met you, Dr. McGill, I don't know, I think it was 9 months ago or so, I was just really blown away by hearing your vision of how healthcare needs to transform and be much more consumer focused and really focus on patient experience. I'd love to hear kind of why do you think that is? And do you think that healthcare needs to learn from other industries like travel industry, Disney, those kind to bring those kind of experiences into healthcare?
Absolutely. So I think if you look at Community Health Network, our mission, vision, but our brand promise. So let's focus there. Our brand promise is exceptional care simply delivered. So when we think of the experience, exceptional care is to some degree table stakes. People expect to have great care that's safe, that's high quality when they come into our health system. It's just the expectation that we all have when you interact with anybody in healthcare. It's that simply delivered portion is really where the experience comes out. I think anybody who's been in any health system lately, it's complicated. It's complicated to navigate, to schedule an appointment, to pay your bill. You have multiple providers that you're getting multiple bills from. You're getting, you got to schedule here, but oh no, you got to get a prior authorization. There's a lot of people or a lot of actors involved in healthcare delivery. And I think that's one thing that makes it very complicated, makes it complex. And that really is where that simply delivered falls apart. So that's really what we've tried to focus on. A lot of times people think of experience as, was the doctor nice to me? Was the nurse polite? Did they, and all of those things are absolutely important. I think treating people as humans is very important. Understanding their personal needs and desires, that's incredibly important, really keeping that human aspect in healthcare. But where we get complaints and people get frustrated and then they don't interact with the system is that complexity and that simply delivered. So that's why we really feel like looking at our processes, looking at technology, looking at all of the interactions that people have with us that may not involve a doctor or a nurse. There's a lot of activity that occurs in healthcare in what I always call the white space of healthcare. And that's the interactions between a face-to-face or a virtual interaction. And I think that's where some other industries, like you said, travel, hotel, some of the retailers that, the big name that we all think about, they've kind of solved some of that white space and that stickiness. I think we need to do some of the same with healthcare. Healthcare is complex. We're dealing with complex issues. We're dealing with very personal. We always say, we run a 24/7 business where 99% of people don't want to be there. Right. And that's very hard to create a great experience under those conditions. But that's the industry we're in, and that's what we have to do.
Well, and it's a incredibly complex industry where a lot of retailers can control the experience end to end, where in healthcare you have multi care facilities, whether it's a primary care or an acute care versus the insurance side of the house, even bringing in, government funded opportunities there. And so it really is, not only do they not want to be there, they don't want to deal with all of those different
Right.
entities. So it's
Right.
very, very complex. Yeah.
Right.
Yeah.
And oftentimes in a lot of places in this country, I mean, we're lucky that, we have a health system in a metropolitan city. But if you think about a large part of our country, there may only be one health system. And so, that's the only option. And I think in some of the other industries, retail industries, you have choices, right? You can, if you don't like that experience, you'll go somewhere else or whatever. But for a lot of people in this country, they don't have choices when it comes to healthcare. Either their payer is telling them where they have to go, or they just don't have other options in their community. And so I think that adds to this complexity of healthcare and the delivery.
Yeah. So even even though it's complex, when people don't have options and when it's life or death, literally sometimes we want to make it as easy as possible. And so one of the other areas that I've heard you talk about is really creating digital experiences. So how are you seeing using digital tools or digital engagement channels like contact center or marketing, or how are you using those to refine that experience? Or what are some of the key areas you're focusing on?
Yeah, so we strive. Our aspiration is that people in healthcare, people when they interact with healthcare, should have the same digital experience that they've come to know in other aspects of their life: banking, retail, like you said, travel. I think that's the expectation. That's what we in as society have come to expect, and so we should be able to deliver that. So being able to, schedule your appointment, search for a provider, know the status of what's going on in your care, meaning if you need a referral, where are you in that referral process? Are you waiting on a prior authorization? We always talk about, hey, when I order a pizza, I know when it goes in the oven, I know when it gets in the delivery car, I know when it shows up at my house. Why can't we create that same experience in healthcare so that people are at least aware? And so those are some of the things that we're working on. But it really gets back to this know me concept that people, I think the reason that retail has been successful is they know you, they know your preferences, they know what you like, what you don't like, how you're ordering, what's your pizza topping, they know all those types of things. We in healthcare haven't done a very good job historically on knowing the person, knowing them holistically. What are their preferences? Do they like to talk on the phone? Would they rather get an email with their lab result? Do they want a text message as a reminder? They want to be able to schedule their appointment via text. So how do we create that kind of know me, that 360 degree around the patient? And I think that's really when it comes back to the digital experiences that we're trying to create. So, we've launched many of the same things that a lot of people have: online scheduling, appointment reminders, obviously the contact centers and some other things. But how do you take it to the next level when you have those interactions, they're more personalized and they know you, or we know you, when it comes to, so just creating a digital experience, I don't think is the key. It's creating a personalized digital experience that really is the differentiator.
Right. Exactly. Really good points. And so we feel, and we met you when you were seeking a CRM, and we weren't the only players out there that was bidding for your business. But product aside or vendor aside, why do you think or feel that an enterprise CRM is key to that? You talked about knowing me as an individual and my preferences. Do you feel, kind of how does a CRM play into that?
Yeah, that's a great question. And we really see it as, personally, I don't know how you create that personalized experience without having some sort of CRM. And some people would argue that the electronic medical record should be the CRM. But like I was saying earlier, I think that's one component because there's all these interactions that occur outside of a face-to-face visit or some sort of clinical interaction that occurs in the EMR. So we've really tried to create that 360. We tried to create, a mobile and web, equal experience, whether you're searching on your phone or you're searching on the website, or you're just searching for care. Maybe I don't know what type of care I need. Maybe I'm not sure if I want to have bariatric surgery or have a knee replacement. I'm just searching and seeking and following that journey all the way through to actually having the condition treated, and then what happens afterwards. So it truly is that 360. And I think that's where the enterprise CRM, whether it's the billing experience or the phone experience, the contact center scheduling, referral, or even the treatment experience, how do you pull all of that together without having an enterprise CRM? Maybe people can do that, but it goes back to what Ellary was talking about. That's a lot of back-end coordination on the technology side that's incredibly difficult to pull off in a seamless fashion. We always talk about we want frictionless experiences.
Yeah.
Whether they're in person, digital, whatever it might be. And so really having that enterprise tool, I think, is the key enabler to that frictionless experience.
What do you say to the EMRs who are creating their own CRM? What's your opinion or your thought on using the new features or capabilities that are stemming from the EMR to do CRM like functions?
Yeah, I think that there's a role for those tools, but I don't think it's I don't personally see how it can be the end all be all for those tools, because those are great for people that have an established relationship with a health system. What about people who don't have an established relationship? What about kind of that guest experience that people have, that we have with other industries in our life? And again, how do you build that 360-degree view on interactions that don't occur or are not based on a clinical interaction? I mean, the EMR at the end of the day is a clinical documentation tool, right? And it's great. We love our EMR. We have great things to say about our EMR, but I don't see how that can capture all of these other interactions that people have with us that are not clinically focused.
Ellary, what are you seeing across other providers with regards to their opinion of enterprise CRM with regards to the kind of know me around digital experiences?
So I think that the conversation is so much bigger than just CRM. I mean, Dr. McGill has talked about the EMR and a lot of those clinical encounters. What I'm seeing, and even what Community Health Network is doing, I don't want to put a spotlight on this if you don't want me to, but I'm going to say it. You guys are building a hub. You're building essentially a smart hub, and Gartner calls it a healthcare consumer engagement hub. And it's really, in essence, being able to pull all of the information or data together from an enterprise CRM, an intelligent CRM, from a customer data platform or consumer data platform, from all of the patient data, so clinical encounters, HIEs, claims, wearables, stuff that's stemming from devices, patient-reported outcome monitoring tools, being able to pull all that together into a single hub, and then allowing for all those walls to break down for basically our clients to be able to understand who their consumers are. And then what Dr. McGill mentioned is, once you know me, how am I going to make sure that I can communicate with you through the channel of choice? So whether you're calling into the call center, whether you want to self-schedule through a bot, whether you want it to come in for a face-to-face interaction, am I engaging with you in a way that's really meaningful? What about a virtual visit or a televisit? Am I able to do that? What about maybe making sure that I'm communicating with you through a mobile app instead of just my patient portal, as an example? So what I'm saying is our clients who are building this concept of the healthcare consumer engagement hub. So they're all starting from some place, but their goal over the next several years is to really combine all of that stuff together with all of the omni-channel experiences so that they can engage in a more personalized and meaningful way with their healthcare consumers.
That's true. And we haven't even touched on the marketing side, right? I mean, I think it starts with the outreach and helping people to understand. There's a lot of misinformation out there. So how can they get information from a trusted source, and understanding that if they've got concerns or they have a need, that we're here for them, and be able to follow that experience all the way through.
Nurturing from unknown to known is huge.
Yeah.
Everybody's trying to acquire new patients. Everybody. Nobody, I mean, I guess maybe there are some who are, large and destination health centers that could say, oh, we have enough, we don't need any more. But most of our clients are saying, hey, we're laser focused on patient acquisition. We want to acquire, and then we want to retain, right? We don't want to lose them to a competitor, to telehealth, that we're not providing. So how do we guide somebody without, in a respectful way, but without knowing exactly who they are? So how do we make sure that it's an engaging experience? Search engine optimization, making sure our website is, got information on it, allows them to start filling out a form or communicate or engage with us. And then once we capture them and they become a patient, obviously, how do we continue to engage with them and then retain them, follow up with them, keep them engaged, support them with gamification, make them feel like they actually enjoy the experience when they do need to come in, and that we're doing things to keep them well when they don't have to come in.
That's right. So a couple of final questions. Dr. McGill, we've talked about so much, and this is a huge undertaking. We have customers that Microsoft supports that have already implemented a lot of these capabilities. Some are on their path to implement, and some are just getting started. For those ones that are just getting started but have similar goals to create a really seamless patient experience, any advice you would give to maybe your peers out there of like where to look or where to get started or start their research to get this journey kicked off?
Yeah, I think there's a first you have to kind of decide strategically where do you want to go, right? And then, I mean, that sounds simple, but that's pretty complex to do. Where do you want to go? Who do you want to be? Those types of conversations. And then I think we kind of take the approach of whether it's technology or other partnerships that we have is kind of that build by partner. And if you look at our tech stack, for example, we'll stick with that. We have a lot of great partners, and we realize our limitations, and so we try and partner with others that will open an ecosystem of partners that we can learn from, and people can learn from us. And so that's really, I think that's where oftentimes the evaluations to start is understanding who you are and what you want to be, where you want to go, but also understanding your limitations. Like we were talking about earlier about innovation, we're not going to go out and stand up our own data hub without a partner. We realize that. And so we really look for strong partners that are willing to innovate with us along the way, right? There may be some things that are new that are development on the innovation and development side. There may be things that are just do it, so we just need to implement. And really that partner to learn and grow along the way. That's really where we started. And really, there has to be a cultural fit. So I always tell I tell people this in many different aspects. There's a lot of technologies out there that you can go buy. You can spend a lot of money, buy things off the shelf, and what do you get? You get an off-the-shelf technology. And I think the difference is what we look for is who has a partnership that has technology attached to it. And I think that's where that's where I would encourage a lot of people to really look and start.
Well, awesome. We hope that Microsoft is one of those partners for you. And just kind of wrapping up, we know that you've decided to move forward with Microsoft as your enterprise CRM. What were some of your major decision factors in making that decision?
I think it was really that partnership conversation. I think it was a cultural fit. The partnership that was a huge factor. This is a big investment. And so whoever you choose, or whichever partner you choose, it's a big investment. But it's not just an investment. I think the other piece of it is, and I had somebody say this to me when we were kind of going through the evaluation process and everything else. I was reaching back out to some of our senior leaders to say, hey, is this the route we're going to go? Are we all in on this, or what are we going to do? And he responded and said, I'm all in. I absolutely think this is the way we should go, but you realize it's going to fundamentally change our organization. It has to fundamentally change our organization. It has to change how we do business. And so I think realizing that and understanding the amount of change that it's going to require to be successful is no small task. And it's so again, having somebody that can walk you through that, I think, is key. But just being honest with yourself, that's really the deciding factor, because it is a huge investment, not just in money, but in time and people and energy. So I think that's a deciding factor. And then again, finally, just like we were saying earlier, health systems have a lot of challenges that they're facing right now, and you have to decide, is this the right time? And so I think there's a lot of I've said a lot of things, but I think when it boils down to why did we choose Microsoft, which is really the crux of your question, why did we choose Microsoft? I would say first and foremost, it was the cultural fit. We felt like partners. We felt like that journey. It was the cultural fit. And then all of those, once we had that connection, all of those other pieces fell into place.
Awesome. Well, we feel like partners with you guys, and we're excited to go on this journey. Ellary, any final comments? I mean, it's been great, learning about Dr. McGill and his team and community. Anything you would add to kind of that partnership conversation?
I think for me, Dr. McGill, the topic of conversation when we got engaged with you was enterprise CRM, but there's so much work that we were already doing with you just as a partner before that. And there's so much work actually that has come out of all of these, engagements and our relationship since then. So I think for me, what I love about Community Health Network is the commitment to the top few vendors that act as partners. And I think that feels like best practice to me. We have clients that say, I'm going to look at my, top 1, 2, 3 vendors, and I'm going to find out if they can do the thing that I'm looking to do. If they can, I'm going to work with them. If they can't, I'm going to see if they've got a partner that can build on their ecosystem that I can work with. And then and only then, if they say no, will I go out and look to the market to kind of get something that's an offshoot or maybe a point solution on a different back end. And so I love the trajectory. I love the engagement and the partnership, and it goes beyond just one thing. We're not just a cloud provider for you. We're not just an enterprise CRM for you. We're not just a collaboration suite for you. We're bringing all of that together and bringing partners to bear that have built really cool healthcare specific IP on top of our platform. So I just want to make a mention that even if it's just one thing that we're specifically narrowly evaluating for our clients, I feel like it's an important differentiator when you're working with Microsoft, that there is so much that we can help you to do first party as you're thinking about consolidating down to just 1, 2, 3 vendors for many, many things. I don't know if you would agree, Dr. McGill.
Absolutely. I think those are the conversations that have become really important in the last 18 to 24 months as people are looking at technical debt and cost to maintain. I think that those, I echo exactly what you just said.
Well, we are so excited about this partnership and really appreciate everybody's time here today. I think our audience is really going to enjoy the conversation and appreciate your time. Dr. McGill, Ellary, and Josh, thank you so much for coming on today and sharing your experience with others.
Thank you. Thanks for having us.
Thank you.